Welcome to CivilNet. My guest is Dr. Raffi Barsoumian, a general surgery specialist in New York. Dr. Barsoumian came with a group of medical health experts to Armenia after the Artsakh war and assisted local doctors in Yerevan hospitals to treat soldiers and civilians who were victims of white phosphorus attacks launched by Azerbaijan. Thank you for joining us, Dr. Barsoumian.
My pleasure. Good morning.
In late October, as I said, Azerbaijan launched banned munitions with white phosphorus on forests in Artsakh. As a result, hectares of forest burnt, but Armenian civilians and soldiers were also harmed by the incendiary weapon. Could you please tell us first what white phosphorus is exactly, and then what are the effects on the human body?
White phosphorus is a chemical munition used in times of war. It's primarily used to deforest areas. It burns very, very hot. It's also used directly upon soldiers as a weapon. But from my understanding, that's not permitted through international law. It burns very hot. It causes tremendous destruction, and the vapors themselves, in addition to the phosphorus, can cause burns. They can cause inhalation burns. When white phosphorus comes onto the soil, for example, all of the debris can continue contaminating anybody who might touch or walk or crawl on the soil for several months afterwards. So it is an extremely dangerous, toxic chemical and causes severe burns all the way to 4th degree to the bone in many cases.
Okay, so you came to Armenia, as I said, a few months ago, and you worked with Armenian medical staff in Yerevan's hospitals, and you treat patients with burns, as you said, due to the white phosphorus. Could you describe us what you saw, your experience there, and have you, just a question like this, have you ever seen something like this in your career in the US?
As a threshold matter, this wouldn't be seen by burn surgeons in developed countries, typically. It's only seen in theaters of battle. And so, no, there wouldn't be an experience here in the United States, or for most of the developed countries in the world, with white phosphorus. The burns themselves, it would almost look like, very much like punched out lesions where someone had poured hot molten metal directly onto a person's skin where it would burn right to the bone. So you see these deep, deep lesions. When I arrived to the National Burn Center Hospital, at that time, the soldiers who had been on the front of the battlefield had been treated by the hospital. So I came at the point where we were continuing to treat these burns and also identifying soldiers who had been exposed to white phosphorus at not only the burn hospital, but also at the military hospital as well. So and Oslik Hospital, we identified a number of soldiers who had been burned, very clearly burned by white phosphorus.
And what is their situation? How do they feel? Is it a long treatment? Do they need to stay for days, weeks, months? What kind of treatments are using the doctors and yourself? What did you do there exactly?
So depending upon the severity of the burn, okay, depending upon the percent total body surface area that's burned, that would be a reflection of how long the soldier's stay would be in the hospital, what treatments would be involved. The soldiers that I saw had been in the hospital anywhere from weeks to months. There would be required number of surgeries to take place, with skin grafting surgeries, first excision of the burn wounds themselves, also stabilizing the patient, removing all of the white phosphorus from their body, because phosphorus itself is toxic. It could cause electrolyte imbalances. So you have to make sure that the patient doesn't have any metabolic or metabolic disturbances or abnormalities. And after that phase, the burn wound is excised, and then the burn wound is grafted. So many of the soldiers went through numerous operations to address their white phosphorus burns. I assisted in taking care of the soldiers at the hospital. I operated at the Daftashen National Burn Center alongside the excellent burn surgeons there, Dr. Raffi Barsoumian, Dr. Raffi Barsoumian, Dr. Som Brutyan, and Dr. Bog. So it was a very trying experience, because these were burns that no one really had any experience with.
So that was actually one of my questions. Are doctors in Armenia qualified enough, according to you, to deal with this very specific kinds of injuries?
It's actually a very good question. I wondered that myself. Let me be very frank with you. If I were to go ahead and have Dr. Karina Babayan, who's the head of the burn center, speak fluent English and bring her here to the United States and put her in a burn center, no one would know the difference between her and any other surgeon here. That's how exceptional a surgeon she is. The other surgeons as well are highly skilled. They're very good. I was very impressed. And they're dedicated. These surgeons were working 100 hours a week in the months of October and well into November. So it was tremendous what they did. And the equipment that they had was very rudimentary. So we were able to, when I learned, my involvement in this all came when I learned that, they needed burn surgeons in Armenia. And when I learned that they didn't even have basic Silvadene cream, okay, and they didn't have a skin grafter to perform, proper burn surgery, it was at that moment that I got a number of my friends together, Hasmed Buzetta, Sartinian, and a number of others, and we pooled our resources and got these necessary devices to them within 6 days of learning of what had happened and what their needs were. And they were grateful. And then a couple of weeks later, I went out and assisted them in the operations and performed operations with them.
Let's ask you another question related to the effects actually on the patients. We talked about the effects for weeks and months and what is happening when they burn directly, but what are the consequences in the long term for these patients? What could be the consequences in the long term?
Provided that the soldiers make it through the initial phase and they survive, these burns, these white phosphorus burns, are usually more extensive and deeper than similar burns caused by, say, flame or direct contact or liquid. But with proper care, these soldiers will recover, and they did recover. Many of them did recover. The long-term effects, they're going to need in the future physical therapy, rehab, which they were also getting at the hospital. They're going to need laser therapy on joints and areas to increase their mobility. They're also going to need psychosocial counseling, which to a certain extent they were receiving while they were there. I didn't come across a soldier whose mother was literally not in the hospital at all times by their hero son's side. So that was very touching to see that.
And let me just ask you this question, but is there a risk of cancer?
Yeah, there are reports that, there is a slight risk of cancer. I shouldn't say slight, but there are reports that in the long term, it's dose related. depending upon the dosage of contaminant that one has encountered, the time with which that white phosphorus had remained in the system, there are, reports that it could cause cancer, liver cancer, renal cancer, a number of different cancers. But again, dose related. Could I necessarily tell you that the soldiers who were burned with white phosphorus are going to develop cancer in 10, 20, 30 years? No, I can't tell you that. I'm not certain of that. My hope is that they're going to be fine and live very productive lives from here on out.
That's very clear. So you spent some weeks in Armenia and treating those patients, as I said, assisting doctors here. This time that you spent here, did you in some way gathered some proofs for lawsuits at an international court, for example, that might be helpful for lawsuits? Armenia's part B put a trial against Azerbaijan, for example. There was a group of French doctors. They came and observed what was happening with the white phosphorus, and they gathered proofs and sent that to France for labs tests. And they plan to maybe use these for lawsuits, or at least help the country Armenia for lawsuits at an international court. Is this something that you also did, or not yet, or you don't plan to do that?
Okay. I spent a month operating in the burn center, and my focus is one of healing. I'm a physician. I'm not a lawyer. But during the time that I was there, of course, the soldiers that I took care of, we'd taken samples of their burned skin. We'd taken samples from other soldiers in other hospitals where we identified white phosphorus exposure. I went directly with devices to identify whether or not white phosphorus had contaminated any soldiers. And if that had happened, we'd taken tissue samples. As far as any lawsuits, like you said, there are groups within the government that have obtained those samples, and they're being sent for testing. From what I understand, the Azeri government, which is a profound hypocrisy, is suing the Armenian government under the guise that it was the Armenian government that used white phosphorus against them. This is the most baseless and idiotic thing I've ever heard. As a threshold matter, you use white phosphorus when you want to deforest an area, okay, or kill enemy personnel. Secondly, white phosphorus is extremely expensive, right? There was absolutely no military reason for Armenia or the soldiers in Karabakh military to want to deforest a forest that was already preventing drones from having a clear line of sight to them. It would make absolutely no military sense. There'd be no reason for them to use it. The only side that would be using the white phosphorus would be Azerbaijan. And that's what they did, both to deforest and also to kill these soldiers.
And last question, do you plan to come back to Armenia once more? And if so, what are your future plans here?
Yeah, I actually do plan to come back to Armenia in several months, hopefully to perform laser surgery on these soldiers to assist in their rehabilitation, increase mobility of their joints, and enable them to regain full function of their joints where they sustain burns, and also their burn wounds. But we're still waiting upon obtaining the laser.
That's very clear. Thank you very much for your great job here. Thank you for watching, and continue to follow CivilNet.